Hello. Today I'm going to talk briefly about the chapter on death and dying. There are a number of books that are written about this. I did go ahead and accomplish a chapter having to do with this. I think as physicians we're taught that death is the enemy, but it doesn't always, I think, be appropriate to think of it that way. There's some people that are having a lot of suffering, and it may be a great relief of them to go ahead and pass on or expire. The old saying that pneumonia is the old man's friend was kind of that idea, but it's only that idea if you don't have to go on the ventilator and try to be revived and so forth. So depends on the circumstances and what the situation of the patient is. Are they terminal? Are they going to go downhill anyway, no matter what you do? I think one of the most important things you can do as a physician is not to withdraw from those patients. There's a natural tendency to withdraw from people you may have been close with or developed a relationship with, or the family. You may tend to withdraw because you're trying to protect yourself from emotional distress. But I think I learned through the years you're better to just go ahead and embrace it rather than cheat yourself out of that experience and cheat the patients out of that experience as well. There's a tendency to deny the inevitability of death, but I think most patients and their family come to understand at some point in some patients' care that it's futile to continue to be aggressive, and it's better to just try to keep the patient comfortable in hospice care. They may prefer to die at home. You want to try to honor those wishes. It's important, though, to try to maintain the quality of life of the patient until it's their time to die. And I mentioned this in somebody I overheard in a waiting room complaining to, I think it was their daughter, that how many tests were they going to have to go through before they were going to be let to die. Well, it depends, a test may help the patient's quality of life in their last days, or perhaps they're not going to be passing away or dying anytime soon. I think that's another thing that people don't understand. Just if they're ready to die, that doesn't mean they're going to die. It depends on their medical circumstances. It may not be their time to die yet. I also mentioned there's a problem with a disconnect with primary care. So the primary care physician a lot of times doesn't go to the hospital and may not be involved in the patient's last days. And so there may not be much of a rapport or any rapport or very little trust with the hospital doctor or hospitalist. So I think that can lead to problems as well. So if you're the hospitalist taking care of the patient, you want to try to develop a rapport with them as best you can. Sometimes the primary care doctor will come and visit the patient even though they're not really writing orders or examining them, just to provide psychological support. I think that can be important. Certainly the family takes on a very important role, and so does hospice a lot of times. I think one of the most important things you can do as a physician is to not withdraw, to care about the patient and give them the support that they need, and let them know that you will keep them comfortable, even if they're about to die. I think that's a very important concept and thing to do. With that, I'm going to go ahead and close on the chapter. That's all on that.